One analogy that I often share that really helps describe this difference of approach, or the opportunity for a multifaceted approach, is that the analogy of a hot air balloon. So if you can imagine a hot air balloon somewhere at some elevation in the sky, yet this hot air balloon, or the elevation of it, is somehow representative of how well somebody is doing in their life. So if that hot air balloon is going higher, that would represent that they're doing a little bit better, they're a little bit more successful, a little bit more flourishing, experience some greater preponderance of positive emotions. And if that hot air balloon were to go down, then that would be indicative of somebody who's getting a little bit more stress, a little bit more of a battle with some internal burdens that they're facing. So with this analogy, there would be two ways, we can see two ways that we could help increase the altitude of that hot air balloon. The first thing that we could do is we could identify any extra weight that was in the basket, maybe some sandbags that we're holding onto the side, and we could do whatever we could to reduce some of that load, some of the, whatever was holding it down, and that would allow the hot air balloon to go higher. Well, the other thing that we could do is simply put some more hot air in the hot air balloon. We could turn on that burner, we could raise the temperature, create more lift. That would also help it go a little bit higher. So I love this metaphor because this is how I understand the difference between traditional or pathology focused treatment or psychology, and the other side, which is the positive psychology. So I understand that traditional psychology and a lot of the traditional programs and treatment modalities that we see, they are really focused on identifying what's wrong with somebody, helping them identify the symptoms, the defects, the diseases, the diagnoses that are representative of that struggle that they're having in their life. And then they can be very effective at helping reduce some of the symptoms or reduce some of that downward pull on that basket. And through that process, allowing somebody to let go of some of those things, heal some of those things, remove some of those internal or external barriers so they can get up to a better place in their life. On the other side, positive psychology is really a focus on what is right with somebody. What are the strengths that you have? What is the natural resilience that you've developed? What are some of the resources that you have internally and externally? And how do we leverage that in order to get to a better place, a place of more flourishing in your life, across many different areas or domains of your life? So with this analogy, it's also easy to see or appreciate how a multifaceted approach, one that is looking at some of the things that are holding somebody down. If you go and you're working in a clinical environment and they're helping you identify and treat and work through some of your diagnoses or some of the symptoms, that can also be supported by working on more of a, in the other domain of positive psychology and working with somebody, whether it's a coach or a mentor or a peer support specialist, helping you reconnect with some of the good things that are already within you that you can leverage in order to get to a better place in your life.